I'm an ICU nurse, and I haven't slept in my own bed for more than 3 nights in a row in almost 3 years. I volunteer for double shifts 4, sometimes 5 times a week. Nobody asks me to. Nobody needs me to. We're understaffed, sure, but not that understaffed. I just stay. My husband thinks I'm a hero. Or he did, anyway, for the first year. "You're saving lives," he'd say when I'd text him at 11 p.m. that I was picking up another shift. The kids understand. Except they don't understand. How could they? Mia is 7, and Tyler just turned 9. Well, he turned 9 3 weeks ago, but I wasn't there for that either. I was at the hospital. I'm always at the hospital. It started small, like these things do. I'd pick up an extra shift here and there when we were short. The money was good, and honestly, I liked the work. I liked being needed. I liked the way families looked at me when I helped pull their loved one back from the edge, like I was some kind of angel. At home, nobody looked at me like that. At home, I was just mom, mediator of toy disputes, and maker of chicken nuggets. Then my mother died. Pancreatic cancer. 6 weeks from diagnosis to funeral. I was with her at the end, in a room just like the ones I work in every day. I held her hand. I understood the monitors, the medications, the timeline. I knew exactly what was happening when her breathing changed, when her pressure dropped. I was a nurse first and a daughter second, even then. After she died, I couldn't stand being home. The silence felt suffocating. The kids needed things. Snacks, help with homework, someone to listen to their stories about school, and I had nothing left to give them. But at the hospital? At the hospital, I knew exactly what to do. Check vitals, adjust drips, document, save lives or ease deaths, clear tasks with clear outcomes. So I started staying. 1 extra shift became 2, became 3, became a baseline expectation that I'd always say yes. By the end of year 1, I was working 60-hour weeks minimum. My manager asked if I was okay. I told her I was fine, just liked keeping busy. She didn't push. We needed the coverage. Year 2, I crossed 70 hours a week regularly. I missed Mia's spring concert. I'd promised her I'd be there, front row, but a patient coded during shift change, and I stayed to help stabilize them. By the time I got to the school, the parking lot was empty. I sat in my car for 20 minutes, still in my scrubs, and told myself it was worth it. That patient lived because I stayed. Mia would have other concerts. She hasn't invited me to anything since. Tyler's birthday last year, his 8th, I was supposed to have the day off. I'd promised. We were going to take him to that arcade he loves, the one with the go-karts. But that morning, Rebecca called in sick, and they were desperate for coverage. "Just a half shift," said my manager. 6 hours, then you can still make the party. I stayed for 12. There was an MVA victim, 23 years old, the same age I was when I had Tyler. She coded twice. I couldn't leave her. By the time I got home, the cake was gone, the presents were opened, and Tyler was in bed. My husband had that look on his face. Not angry, just resigned. "He waited for you until 9 p.m. He kept asking when you were coming." I told him I'd make it up to him. I didn't. This year, his 9th birthday, I wasn't even supposed to work. I'd blocked it out weeks in advance. But the morning of, I woke up in my own bed, next to my husband, and felt this crushing anxiety in my chest. What do I even talk to my son about anymore? What does he like now? I didn't know. I knew my patient in room 7 had a daughter in college studying engineering. I knew the woman in room 12 was allergic to morphine and her sister visited every day at 2 p.m. But my own son? I'd become a stranger. So I went to work. I told my husband there was an emergency. And there wasn't. I just volunteered for a shift and he assumed they'd called me in. He didn't even argue anymore. The kids ask him why I don't live there. He told me that last month, crying in our kitchen at 1 a.m. when I finally came home. "They think you moved out," he said. "Tyler asked if we're getting divorced. Mia stopped putting you in her family drawings at school." I should have felt something. Panic, guilt, heartbreak. Instead, I felt relief that I was going back to the hospital in 6 hours. I'm not saving these people because I'm noble. I'm hiding. Every dying patient I hold hands with, every family I comfort, every code blue I run, it's easier than going home and facing what I've become. At the hospital, I'm competent, essential. I know exactly what to do and when to do it. At home, I'm a failure, dressed in wrinkled scrubs who forgot her daughter's favorite color and couldn't tell you what grade her son is in without checking. The thing is, I'm not even a good nurse anymore. Last month during a code, I nodded off, standing up, in the middle of it, just for a second, 3, maybe 4 seconds, but enough that I almost missed my role pushing the crash cart. Lisa covered for me, grabbed the cart herself, and nobody said anything. But she looked at me afterward with this expression that was half concern, half disgust. I'm running on 4 hours of sleep a night, sometimes 3. I've had 2 minor car accidents this year, both times falling asleep at red lights, drifting into the car ahead. Nothing serious, just bumpers, just proof I'm not as invincible as I pretend. My hands shake now when I'm not actively working. I've lost 23 pounds. I know because I weigh patients and started weighing myself on the same scale. My blood pressure is 148/95. I had chest pains 2 weeks ago during a shift and ignored them. They passed. Probably stress, probably fine. Our wedding anniversary was in September. 16 years. My husband made reservations at the restaurant where we had our first date. He hired a babysitter. He texted me the address and said he'd meet me there at 7 p.m. I was getting off at 6. I stayed until 9:30. There was a new admission, a woman with sepsis, and her daughter was terrified. The daughter was maybe 19, crying, asking if her mom was going to die. I held her hand. I explained everything. I stayed with them through the initial treatment, through the stabilization, until the mom was settled and the daughter stopped shaking. My husband was already home when I got there. The reservation was canceled. He had eaten the babysitter's dinner himself since he'd already paid for it. He didn't yell. He just said, "I can't do this anymore." I thought he meant he couldn't handle me working so much, that we'd have a fight, I'd promised to cut back, things would settle down. But he meant us. He meant the marriage. He said he's talking to a lawyer. And here's the thing. Here's the part that makes me know I'm broken. I felt relieved. Because a divorce means I can stop pretending I'm going to change. I can stop making promises to be home for dinner, to take days off, to choose them. I can just be what I've become. A nurse who lives at the hospital and has nowhere else to go. I'm sitting in the break room right now at 3 a.m., typing this into my phone while my patient in room 4 sleeps. He's 68, former contractor, lung cancer. He reminds me of my dad. Same beard, same way of cracking jokes, even when he's struggling to breathe. His family visits every day. His wife brings him crossword puzzles. His son calls every morning at 8 a.m. sharp. I wonder if my kids will visit me when I'm dying. If they'll even know which hospital I'm in. My shift ends in 4 hours, but there's a 7 a.m. admission coming in. Trauma case, details pending. I'll probably stay for it. Nobody's asking me to. Nobody needs me to specifically. But I will anyway, because the alternative is going home to a house where my children see me as a stranger, and my husband is planning his exit. At least here, people need me. Even if I'm barely functioning. Even if I'm one missed code away from disaster. Even if I'm slowly killing myself in 4-hour increments. At least here, I know what to do.
I haven't called out sick in 11 years. Not once. Not for the flu, not for migraines, not for the funeral, not even after the car accident. I'm Jennifer Coldwell, RN, ICU, and I'm the nurse who shows up. That's who I am. Or was. I don't know anymore. It started as something I was proud of. Year 3 on the unit, I realized I had perfect attendance. My manager mentioned it during my review. "You're so reliable, Jennifer. We can always count on you." Something about the way she said it made me feel essential, like I mattered in a way I didn't matter anywhere else. So I kept going. Year 4, year 5. I worked through a stomach bug that had me vomiting in the staff bathroom between patient checks, worked through a sprained ankle, worked through the worst migraine of my life with the lights dimmed in my patients' rooms, squinting at monitors through the haze. Every time I pushed through, I felt this quiet pride. I'm tougher than this. I don't quit. My coworkers started joking about it. "Jennifer's never sick. She's made of steel. Don't bother calling her, she'll already be here." It became part of my identity, the reliable one, the one who never lets the team down. Year 7, my father had a stroke. Massive. He was in our ICU for 2 days before they transferred him to neuro. I took my 2 scheduled days off that week. I was there when he died, but I came back for my next shift, 48 hours after his funeral. My manager pulled me aside, told me I could take bereavement leave. I said I was fine. Work was better than sitting at home with my mother's grief and my own thoughts. I wasn't fine. I kept seeing my father's face in my patients. Every elderly man on a ventilator became him. But I showed up. I did my job. I was dependable. COVID broke something in everyone, but it cemented something in me. We were drowning, short-staffed, overworked, watching people die in numbers we'd never seen. I worked 60, 70-hour weeks, picked up every shift I could, slept 4 hours a night. My husband begged me to slow down. My kids, teenagers by then, said I was never home. But the unit needed me. People were dying. How could I possibly call out? I got COVID in the second wave. Moderate case, fever, cough, chest tightness. I quarantined the required 10 days, but I came back the day I was cleared, even though I was still exhausted, still coughing. My manager looked concerned, asked if I was sure. I told her I was fine. We were understaffed. I was needed. Looking back, I don't think I could have stayed home if I'd wanted to. Being at work was the only thing that made me feel like I had value. At home, I was just mom, just wife, roles I was failing at. But at the hospital, I was indispensable. Year 9, I had a car accident. Nothing major. Someone rear-ended me at a stoplight. Whiplash, some bruising from the seat belt. I went to the ER, our ER, got checked out, got cleared. I was scheduled to work that night shift, 7 p.m. to 7 a.m. The ER doctor suggested I call out, rest, take some ibuprofen. I went upstairs and clocked in at 6:45 p.m. My neck hurt for weeks. I worked through it. That's when my family started getting worried. My daughter Emma, she was 17, asked me why I couldn't just take one night off. "You were in a car accident, Mom. Normal people rest." I told her we were short-staffed. Someone had to cover. She looked at me like I was a stranger. My husband, Mark, tried a different approach. Sat me down, said he was concerned about my health. I'd developed high blood pressure, 148/92 at my last checkup. I was getting migraines 2-3 times a week. I'd gained 30 pounds from stress eating and never having time to exercise. I was 46 years old and felt 60. He said, "You're burning out, Jennifer. Everyone can see it but you." I told him I was fine. I had a job to do. People depended on me. He asked when I'd started depending on them needing me. I didn't have an answer. The migraines got worse. Chronic, the neurologist said. Stress-induced. She prescribed medication, told me I needed to reduce my work hours, manage my stress better. I nodded, filled the prescription, kept working my full-time schedule plus overtime. Last year, I had 3 episodes at work where my vision got blurry and I felt like I might pass out. Blood pressure spikes, probably. I sat down in the break room until it passed, then went back to my patients. I didn't tell anyone. If I reported it, they might make me go home. They might make me see occupational health. They might restrict my hours. I couldn't let that happen. Being at work was the only place I felt like myself. 6 months ago, my kid sat me down. Emma, she's 20 now, in college. My son Daniel is 18, senior year of high school. They'd clearly planned what they were going to say. "Mom, we need you to get help," Emma started. "You're killing yourself for a job that would replace you in 2 weeks if you died." Daniel was more blunt. "You missed my last 3 birthdays because you were working. You didn't come to my senior night for basketball. You're never home, and when you are home, you're exhausted and miserable. We're worried you're going to have a heart attack or a stroke, like Grandpa." I tried to explain. The unit was short-staffed. My patients needed me. If I called out, someone else would have to pick up my assignment, and they were already overworked. "So let them figure it out," Daniel said. "You're one person, Mom. You can't save everyone." But that's the thing. I wasn't trying to save everyone. I was trying to save myself. Because if I wasn't the reliable nurse, the one who never calls out, the one everyone counts on, then who was I?
3 months ago, my manager called me into her office. I thought maybe I was getting recognized for something. Another attendance award, maybe. Instead, she looked uncomfortable. "Jennifer, I need you to take some time off," she said. "Medical leave. At least 2 weeks, possibly more." I felt panic rising in my chest. "Why? I'm fine. I haven't called out. I know you haven't called out. That's part of the problem." She slid a piece of paper across the desk. "HR flagged your file. You haven't used any PTO in over 2 years. You're showing signs of severe burnout. Several staff members have expressed concern." "Who?" I demanded. "Who's been talking about me?" "It doesn't matter who. What matters is that you're not okay, and we can't have nurses working at this level of exhaustion. It's a patient safety issue." Patient safety issue. The words felt like a slap. I'd never compromised patient safety. Never. I was the most careful, most thorough nurse on the unit. "I'm ordering you to take leave," she said. 2 weeks minimum. If you refuse, I'll have to escalate this to the director." I took the leave. I didn't have a choice. Those 2 weeks were the worst of my life. I didn't know what to do with myself. I cleaned the house. It needed it. Everything was filthy because I'd been neglecting it for years. I tried to reconnect with my kids, but they were busy with their own lives, and the distance between us felt impossible to bridge. Mark tried to be supportive, but I could feel his resentment. Years of me choosing work over family had left scars. Mostly, I felt empty, purposeless. I'd check my phone obsessively, waiting for the unit to call and say they needed me, begging me to come back. They never called. When I returned, nothing had changed. The unit hadn't collapsed without me. Patients had been cared for. Shifts had been covered. I was replaceable, just like Emma said. That realization should have been freeing. Instead, it was devastating. I'm seeing a therapist now, twice a week. She says I have an unhealthy attachment to my role at work, that I've been using my job to avoid dealing with deeper issues: grief over my father, guilt about being an absentee parent, anxiety about aging and mortality. She says I need to develop an identity outside of nursing. I don't know how to do that. I've been a nurse for 23 years. It's all I know. My family staged another intervention last month. Mark, Emma, Daniel, even my mother. They gave me an ultimatum: cut back to part-time and commit to therapy, or Mark was moving forward with separation. Emma was crying, Daniel looked angry, my mother just looked sad. You're disappearing, Jenny. You're turning into a ghost, and we're all watching it happen. I agreed to cut back. I'm down to 3 12-hour shifts a week now instead of 5, plus overtime. It's killing me. On my days off, I feel this gnawing anxiety, this certainty that something terrible is happening at the unit and they need me. I check my phone constantly. I've driven to the hospital twice on my days off just to make sure everything was okay. My therapist says this is withdrawal, that I am addicted to being needed, to the identity of being indispensable. She says I need to learn to sit with the discomfort of not being at work, to rediscover who I am outside of my scrubs. But I don't know who that person is. I look at myself in the mirror, the weight I've gained, the chronic exhaustion in my eyes, the stress lines, and I don't recognize myself. I'm 47 years old. My blood pressure is still high even with medication. I have panic attacks on my days off. My marriage is hanging by a thread. My kids love me but don't really know me. And the worst part? Some part of me still believes that if I just went back to working full-time, if I could just be that reliable nurse again, everything would be okay. That feeling of being essential, being needed. I'm terrified I'll never feel that anywhere else. Last week, I was offered a charge nurse position. More responsibility, more hours. My old self would have jumped at it. The self I'm supposed to be becoming knows I should say no. I haven't answered yet. I keep the email open on my phone, reading it over and over. My next therapy appointment is tomorrow. I know what she'll say. I know what my family would say. I know what I should do. But I also know that when I'm at work, when I'm in that ICU, when I'm needed, that's the only time I feel like I exist, and I don't know how to let that go, even if it kills me.
I have a spreadsheet, 17 tabs, color-coded, updated daily. Patient survival rates by shift, by month, by severity score, complication rates, length of stay averages, patient satisfaction scores, my numbers versus unit averages, my numbers versus every other nurse on the floor. I'm Sarah Mitchell, RN ICU, and for 3 years I've been the best nurse on this unit. I have the data to prove it. I also have a formal investigation pending, 2 destroyed careers on my conscience, and the growing suspicion that everyone knows what I've been doing. It started innocently enough. Quality improvement project, 5 years ago. We were supposed to track our outcomes to identify areas for growth. Most nurses did the bare minimum, logged what they had to, forgot about it. I got obsessed. I created my own tracking system, more detailed, more granular. I wanted to understand exactly what made the difference between a patient who made it and one who didn't. Every patient I had, I logged everything: diagnoses, interventions, complications, outcomes. I spent hours entering data, running analyses, looking for patterns. And I found them. Small things, timing of assessments, which protocols worked better, how to spot deterioration earlier. My outcomes started improving, measurably, noticeably improving. My manager noticed. Sarah, your mortality rate this quarter is outstanding. Whatever you're doing, keep it up. That felt incredible. Like I'd unlocked something, like I'd become better than everyone else through sheer dedication and intelligence. So I kept tracking, kept optimizing, started requesting specific patient assignments, the sickest ones, the most complex cases, because those were the ones where my interventions made the biggest difference, where I could really prove my value. Year 2, I started comparing myself to other nurses. Not officially, just keeping notes. Lisa in Pod B had a higher complication rate than me.
Tom lost more patients. Rachel's length of stay numbers were terrible. I wasn't being competitive, I told myself. I was just being thorough, data-driven. But I started caring about it a lot. When another nurse had a patient with a good outcome, I felt this ugly flash of resentment. When someone else got praised in huddle for saving a patient, I'd go back to my spreadsheet and remind myself that statistically, I was better. Over time, on average, by every metric that mattered. I started gaming the system. Small things, at first. Requesting assignments where I knew I could optimize outcomes, avoiding the truly hopeless cases, the ones that would drag down my numbers no matter what I did. When I had to take a high-risk patient, I'd document obsessively, noting every single intervention, building a paper trail that showed I'd done everything possible. My numbers kept improving, and people noticed. "Sarah's success rate is remarkable," my manager said during a staff meeting. "She's really the gold standard for this unit." I felt everyone's eyes on me. Some admiring, some resentful. That resentment bothered me more than it should have. Because what if they started trying to compete? What if their numbers started approaching mine? That's when things got darker. Melissa was a newer nurse, 2 years on the unit. Good nurse, careful, by the book. She was assigned to a patient in multi-organ failure, a case I'd specifically avoided requesting because the odds were terrible. Against all expectations, she managed to stabilize him. He made it to step down. It was impressive. In huddle, our manager praised her effusively. "This is exactly the kind of critical thinking and persistence we need. Great work, Melissa." I smiled and congratulated her. But inside, I was calculating. This one win would boost her quarterly numbers significantly. If she kept this up, she might start approaching my outcomes. 2 weeks later, I was auditing charts, part of my role on the quality committee, and I noticed Melissa had documented a medication at 1400 that she actually gave at 1415. The patient's vital signs sheet showed the timing discrepancy. It was minor. 15 minutes. The kind of thing that happens constantly when you're slammed and chart after the fact. I reported it. I told myself it was about patient safety, about maintaining documentation standards. But really, I wanted a mark on her record. Something to make my perfection stand out more clearly in comparison. Melissa got a written warning. She was devastated. I watched her cry in the break room and felt nothing except a quiet satisfaction that my position was secure. That should have been my wake-up call. Instead, it was permission. David was next. He'd been on the unit for 4 years, solid nurse, well-liked. His outcomes were good, not as good as mine, but close enough to make me uncomfortable. We were both being considered for a charge nurse position. I started watching him more carefully. Everyone makes small mistakes. Small corners cut when the shift is chaotic. I knew because I'd made them too, though I was always careful to hide the evidence. David wasn't as careful. I caught him once giving a med 5 minutes early because the patient was heading down for a scan and he wanted to stay on schedule. Protocol violation, technically. I documented it. Sent it to management with a note about concerning patterns and patient safety concerns. Then I caught him putting in a Foley without documenting the indication first. Again, technically wrong, though he charted it 20 minutes later. I reported that too. 3 documented incidents in 2 months. David was put on a performance improvement plan. He was furious, said I was targeting him. My manager talked to me about it. I showed her my documentation, explained that I took patient safety seriously, that someone had to maintain standards. She believed me. David got passed over for the charge nurse position. I got it. He transferred to another unit 3 months later, told everyone I'd run him off. Some people believed him. Most didn't. I had the reputation of being the best nurse on the floor, the one with the stellar outcomes. Why would I need to sabotage anyone? But David's accusations made me paranoid. What if people started looking at me more closely? What if they discovered that my outcomes were good partly because I manipulated assignments, cherry-picked patients, documented defensively to an obsessive degree? That's when I started making mistakes. I was so focused on protecting my numbers, so anxious about maintaining my position, that I stopped being a good nurse. I'd spend hours updating my spreadsheet when I should have been at the bedside. I'd obsess over documentation instead of focusing on actual care. My hands started shaking, I developed insomnia, lying awake at night running numbers in my head, calculating what my monthly outcomes would be, comparing myself to everyone else. I started having panic attacks before shifts, terrified that today would be the day I lost a patient and ruined my statistics.
Last year, Jessica joined our unit. New grad, eager, smart, and unlucky. She got slammed with difficult cases her first 6 months. Patients who coded despite perfect interventions. Complications that were unavoidable. Her numbers looked terrible, but anyone with experience knew it was just bad luck, tough assignments. Our manager knew this. She was protecting Jessica, giving her more time to adjust. But I looked at Jessica's statistics and saw an opportunity. During a quality review meeting, I presented data comparing outcomes by nurse. I didn't name names, but I made sure the numbers clearly identified Jessica as an outlier. I raised concerns about competency and suggested additional training or supervision might be warranted. My manager looked uncomfortable. "Sarah, you know those patients were extremely high acuity. Jessica's done nothing wrong." "I'm just looking at the data," I said. "Patient outcomes should be our priority." They put Jessica on an improvement plan anyway. Not because she'd done anything wrong, but because I'd created enough doubt. She quit 2 months later. Before she left, she came up to me in the medication room. "You know what you did," she said quietly. "You know I was a good nurse. And you destroyed me anyway." I told her I didn't know what she was talking about. But I did. And watching her walk out, knowing she was leaving nursing entirely because of what I'd done, I felt sick. Actually physically ill. But I also felt relieved. One less person to compete with. Last month, my manager nominated me for Nurse of the Year. Regional award. Prestigious. The application required detailed outcome data. Mortality rates, complication rates, patient satisfaction scores. My numbers were exceptional. Of course they were. I'd been manufacturing them for 3 years. I should have been thrilled. Instead, I was terrified. Because the award process includes peer reviews, interviews with colleagues. And I absolutely know that some of them suspect. David definitely does. Melissa probably does. Jessica certainly does. What if they talk? What if someone looks closely at my patient assignments and realize I've been gaming the system? What if they compare my documented interventions to what actually happened and find discrepancies? The investigation started 2 weeks ago. Anonymous concerns about professional conduct, my manager said. Someone filed a complaint. Multiple complaints, actually. Allegations of statistical manipulation, selective patient assignment, deliberately sabotaging colleagues. They're auditing my charts going back 3 years, looking at assignment patterns, interviewing staff. I can't sleep. I can't eat. Every time my phone rings, I think it's HR calling to suspend me. My husband keeps asking what's wrong. I can't tell him. How do I explain that I destroyed 3 people's careers because I was obsessed with being statistically superior? The worst part is the spreadsheet. I still update it. Every single day. Even now, facing investigation, possibly facing disciplinary action or license suspension, I still compulsively track my numbers. Last shift, I had 2 successful extubations and 0 complications. My quarterly mortality rate is still 4.2% below unit average. I don't know how to stop. This is who I've become. Not a nurse who cares about patients. A nurse who cares about numbers, about being the best, about winning a competition nobody else knew we were having. I got an email yesterday. The Nurse of the Year committee wants to schedule my interview. They need 3 professional references.
I stared at that email for an hour. Who would give me a reference? Who's left that I haven't destroyed or alienated? The nurses who like me only like the version they think I am, the dedicated professional with exceptional outcomes. They don't know about the spreadsheet, the manipulation, the sabotage. If I withdraw my nomination, it looks suspicious. If I move forward, the interview process might expose everything. Either way, I think I'm done. My therapist, I started seeing one last month, asked me what I was really afraid of. I told her I was afraid of losing my license, my career, my reputation. But what are you really afraid of? She pressed. I couldn't answer, but I know. I'm afraid that without the numbers, without being the best, I'm nothing. Just an average nurse who destroyed 3 people's lives for a spreadsheet and an ego. I'm in the parking lot right now, 30 minutes before my shift. I need to go inside. I have patients waiting. But I keep thinking about Jessica's face when she told me I'd destroyed her, about David's anger, about Melissa's tears. My phone just buzzed. Email from HR. Mandatory meeting tomorrow, 2 p.m. Please bring union representative. I think it's over. I think they know. And the worst part? The absolute worst part? I just checked my stats from last month. Best numbers I've ever had. 2.1% mortality rate, 0 complications, patient satisfaction scores at 98%. Even now, knowing what's coming, some part of me is proud of that. Some part of me still thinks it was worth it.
I felt excited when Mrs. Patterson's pressure started dropping, just for a second, maybe 2, before the professional training kicked in and I called the code. But in that split second, I felt a surge of adrenaline, a flash of almost pleasure. That's when I knew something was wrong with me. I'm Rachel Simmons, ICU nurse for 9 years. And I'm addicted to emergencies. Not helping people, the actual crisis itself, the chaos, the adrenaline, the razor edge of life and death. I live for codes and traumas, and the moments where everything hangs in the balance. And I'm starting to hate myself for it. It didn't start this way. First few years, emergencies terrified me, like they terrify every new nurse. That whole body panic when the alarm goes off, the fear of making a mistake, the crushing responsibility of someone's life in your hands. I'd go home shaking after a bad shift, replaying every decision, wondering if I'd done enough. But somewhere around year 3, the fear transformed into something else. I got good at codes, really good. I knew the algorithms by heart, could place lines in my sleep, stayed calm when everyone else panicked. I became the nurse people wanted in the room during a crisis. And I started to crave that feeling. The rush of a code blue. The way time seems to slow down and speed up simultaneously. The hyper-focus where nothing exists except the patient and the protocol and your own hands working. The way the world narrows to this single point of absolute clarity. No room for anxiety, for overthinking, for the normal messiness of life. Just pure action and reaction. I started volunteering for the sickest patients, the ones most likely to crash, the fresh post-ops with unstable vitals, the septic patients on 4 pressors, the trauma cases. Everyone thought I was brave, taking the hardest assignments. My manager praised my willingness to handle high-acuity cases. Really, I was chasing a high. On stable shifts, the ones where everyone is slowly improving, where it's mostly routine assessments and medication passes and documentation, I felt this creeping boredom, this irritability, like I was wasting my time, wasting my skills. I'd catch myself checking the monitors obsessively, almost hoping to see something change, hoping for a reason to spring into action. Year 5, I realized I was disappointed when patients stabilized too quickly. A trauma case came in, MVA, critical but viable. I worked on him for 3 hours. Intubation, line placement, massive transfusion protocol, right on the edge. And then he stabilized. Pressure came up, stopped bleeding, vitals normalizing. I felt let down, deflated, like someone had turned off a switch. That's not normal. I knew it wasn't normal, but I told myself it was just burnout, just the weird psychology of emergency medicine. Lots of nurses feel this way, right? The adrenaline addiction is real. It's practically a cliche. But it kept getting worse. Year 6, I started feeling restless on my days off, anxious, like I was missing something. I checked my phone constantly, hoping for a text from work saying they needed me to come in, that there was a crisis, that something was happening. My husband noticed. "You can't even relax anymore," he said. "You're always on edge, waiting for something." He was right. Normal life felt unbearably slow. Grocery shopping, watching TV, having dinner with friends, it all felt muted, colorless, like I was sleepwalking through it. Only at work, during emergencies, did I feel truly awake. I started picking up extra shifts. Not for the money, we didn't need it. For the possibility. The chance that something would happen. A trauma would roll in. Someone would code. I'd get that hit of adrenaline that made everything else bearable. Year 7, I requested a permanent transfer to night shift. Nights are slower usually, but when something goes wrong at 3 a.m., it goes really wrong. Fewer resources, fewer staff, higher stakes. I told my manager I preferred the pace. She was thrilled. Nobody wants permanent nights. Really, I wanted the intensity. My marriage started falling apart. My husband said I was never really present, even when I was home, that I seemed to be waiting for an excuse to leave, to get back to the hospital. He wasn't wrong. Family dinners felt like an obligation. My daughter's soccer games felt interminable. I'd sit in the stands watching her play, and part of my brain was wondering what was happening at the hospital, who was coding, what I was missing. Then came the thing I can't forgive myself for.
Year 8. I was working a relatively quiet night. 4 patients, all stable. One was a 63-year-old man, Mr. Chen, post-CABG surgery, doing well. Extubated that morning, vitals solid, probably moving to step down in a day or two. Around 2 a.m., his cardiac monitor showed a few irregular beats. Nothing alarming. Occasional PVCs, pretty normal for post-cardiac surgery. I documented it, watched for a few minutes. It resolved. But for just a moment, maybe 5 seconds, I felt this flash of hope. Hope that it would get worse, that it would deteriorate into something that needed intervention, that I'd get to do something other than routine assessments and documentation. I felt excited at the possibility of this man's heart failing. The thought hit me like ice water. What the fuck was wrong with me? This was someone's father, someone's husband, and some sick part of me was hoping he'd crash just so I could feel alive. I went to the bathroom and threw up. Sat on the floor of the staff restroom for 20 minutes, shaking. I knew then that I was broken, that something fundamental had warped in me, but I couldn't stop. Year 9 has been the worst. I requested transfer out of ICU twice, filled out the paperwork, talked to managers about step-down positions, outpatient roles, anything that would get me away from the constant possibility of crisis. Both times, I couldn't go through with it. The thought of working somewhere stable, somewhere boring, somewhere I'd never feel that rush, it was unbearable. Like asking an addict to quit cold turkey. I'm having intrusive thoughts now. Not about harming patients, I'd never, could never, but inappropriate reactions to their decline. Last month, a 34-year-old woman with fulminant liver failure, watching her deteriorate over 3 days. And underneath my genuine compassion, underneath my professional care, there was this awful current of engagement, of being fully present in a way I never am anywhere else. She died. I held her wife's hand while it happened. I cried with her. And when I went home that morning, I felt more centered, more satisfied than I had in weeks. What kind of person feels satisfied after watching someone die? I'm seeing a therapist now, twice a week. I told her about the adrenaline addiction, the restlessness, the difficulty functioning outside of crisis situations. I haven't told her about the inappropriate excitement, about hoping patients deteriorate, about feeling disappointed when they stabilize. I'm terrified to say it out loud, terrified of what it makes me. She says it's vicarious traumatization, compassion fatigue, burnout, that emergency medicine selects for people who handle adrenaline well, and sometimes we get psychologically dependent on it, that it's a recognized phenomenon, that I can work through it. But I don't think she understands how deep this goes. This isn't just adrenaline addiction. This is something darker. Last week, I was working when a code was called in another pod. I wasn't assigned to that patient, but I ran over to help. They didn't need me, plenty of staff already there, but I pushed into the room anyway, desperate to be part of it, desperate for that feeling. Afterward, one of the other nurses looked at me oddly. "You okay, Rachel? You seemed really intense?" I don't know what she saw in my face. I'm terrified it was the truth. I'm sitting in my car right now, in the hospital parking lot. It's 6:30 a.m. My shift ended 30 minutes ago. I should go home. My daughter has a field trip today. I promised I'd see her off. My husband has been trying to talk to me about our marriage for weeks. But there's a trauma coming in at 7. Major MVA, multiple critical patients. I heard about it at shift change. I'm not scheduled. Nobody needs me to stay. I'm going to stay anyway. Because out here, in the parking lot, in the normal world, I feel nothing. Empty. Going through the motions of a life that doesn't feel real. But inside, during the chaos, during the crisis, that's the only time I feel like I exist. I know I need to quit. I know this is destroying me, destroying my family, destroying whatever humanity I have left. My therapist is recommending an intensive outpatient program. My husband is talking about separation if I don't make changes. But the thought of leaving nursing, of never feeling that rush again, of spending the rest of my life in the gray flatness of normal existence, I don't know if I can do it. I don't know who I am without the adrenaline, without the codes and the crises and the moments where I feel fully electrically alive. My phone just buzzed. Text from the charge nurse. "Rachel, we could really use you for this trauma if you're still around." They could use me. They need me. That's what I tell myself as I get out of the car and walk back toward the hospital doors. That I'm needed, that I'm helping, that this is about patient care. But really, I'm just an addict looking for her next fix. And the drug I'm addicted to is other people's suffering.